Greetings, everyone, and welcome to our fourth episode of What to Expect When You're Expecting During COVID-19. I'm Ivy Hartman, and joining me is Board Certified OBGYN, St. Louis area native, author, and health guru, Dr. Eboni January. Now, we're going to jump right in with Dr. January. We've talked about other things in our previous episode, including what happens if one of our kids gets sick, what to expect at a doctor's visit. But Dr. January, how would you advise one of your expecting patients if they became ill and suspected it was the coronavirus due to COVID-19? How would they be tested? Would treatment be different?
So, very, very good question. One, if you think that you are sick, and most people are parents, and most people have people in their family, start self-isolating immediately. Mask, the glove. Some people don't have access to those things, completely understandable. They're now making that more accessible. I recently did a challenge called a bra mask challenge where I turned a bra into a mask, which was developed 4 years ago by a doctor out in Chicago. But one, start self-isolating. Number two, call your physician. Remember, we talked about triaging via video conference, and that is the most beneficial. If you are, and what we do know, like we stated, is that we don't know about how COVID responds and how it is in pregnancy, but we do know certain things about how pregnant women respond as it pertains to viral illnesses. And that we also know can extrapolate out to see how it will behave in pregnant women as we speak now. So for instance, we do know when a pregnant woman has a high fever in the first trimester, it can lead to birth defects. So we do know that, for example. So if you have a high fever, call and get in. The most important thing about calling, because a lot of people are like, well, I don't want to call, I just want to go. Well, we don't know if you are positive, you're going to expose the people that are in the waiting room, the people who are in the ER, your physician. We have to prepare to accept you. We have to put you in a negative pressure room. We have to minimize your contact with healthcare providers and things like that. So that's the importance, is not just looking out for you, but what COVID-19 has taught us is that we have to look out for each other, and we don't know that our actions are affecting other people. So that's the importance of calling ahead to say, hey, these are my symptoms. So fever is definitely something in the first trimester that we want to get down, and we want to get down quickly. Shortness of breath, like I said, obviously most pregnant women will have shortness of breath, but if it's, seems a bit different, then you definitely want to call ahead and then make the necessary arrangements. Make the people in your family aware that, hey, I think that I may have come down with something, and that way they take the necessary precautions as well. Call in help, wipe things down. And then when help comes, then they are not exposed to your secretions and things like that. So we have to take the necessary precautions to not just protect ourselves, but our children and our family members. And then when we go into the doctor's offices and emergency room, those individuals as well.
Yeah. And, that's great because that, like you said, a high fever could apply to anything. And we've seen historically how that translates for women who are expecting, especially in their first trimester. Talk to me about testing. I don't feel like I know enough about testing. What is it like, and how long before I get a result? Tell me more.
So it's interesting is that now testing has been a huge issue because we had to minimize the amount of tests that were out there and had to really be selective on who we actually test. Someone who was at risk, those are the people that we check first. Those are the diabetics, those are the hypertensive people, cardiovascular disease. We had to limit tests to those individuals. And what they're now in the phase of developing a rapid test, and it's my understanding that they're now starting to get those out there, but the results of the test are now taking maybe 2 days or so, but there may be one that may even be quicker. But before it was even taking longer than that. So we had to say, okay, we think she may be positive or he may be positive. Let's, have them self-isolate. But if symptoms were worse than expected, then those are the people who needed to be admitted to the hospital. But it's essentially a swab that goes down the nasal passage or back of the throat. And like I said, it could take some time to actually get the results back. So immediately, started those treatment measures. And when I say treatment, I don't mean a particular medication.
Yeah. What do you mean by that? That's kind of what.
Just supportive therapy, supportive. So making sure breathing, that people are not, the breathing is not worsening, making sure you're hydrated, making sure that you are taking a ton of vitamin C. Those are the supportive measures that people are taking, making sure that fevers are down, the Tylenols. We can't give Motrin in pregnancy if we do it for a short period of time, but those are the supportive measures, meaning taking the fever down. If someone is coughing, treating the cough with supportive measures, over-the-counter things. A question that I get asked a lot in pregnant women is, what can I take, if I develop cold or flu-like symptoms? And it's like, there is so much. That's the great thing, is that in pregnancy, there are a lot of things like Robitussin, Tylenol, Benadryl that is actually safe to take in pregnancy. My first visits, when people come, I give them a do's and don'ts of pregnancy. And it's like maybe 6 pages. I flip it to the back page, and it's all the medicines that are safe to take in pregnancy. And typically our nurse, when they come in for their first, what we call case management visit, they will give them this document. But I can guarantee you that women will lose it. So when they finally see me, I give it to them again. They're like, oh, I got this. And I say, I know you're going to lose it. So I'll give you this, and I'll probably give it to you again. But I always focus on that back page of medicines that are safe to take in pregnancy. And there's so many things that are over the counter that are safe to take in pregnancy.
So it sounds like if I'm pregnant and I'm wondering what's safe to take, I probably should check with my doctor first.
Check with your doctor. Like I said, reading is definitely fundamental. You can find these things that'll say, okay, this is safe to take in pregnancy. The information is so easy to find, but if you're questioning it, it's definitely fine. Telemedicine, like I said, is great. You can always email me and I'll say yay or nay, but also to consult with your physician.
Perfect. We'll have contact information for Dr. January here at the close of this. So it sounds like just making sure that you're taking care of yourself, you're able to take care of others, and they can take care of themselves. If you do get sick, you can kind of self-quarantine, but you got to call in help. So making sure surfaces are clean, that you are not coughing or breathing on one another. Any other tips or tricks so that if I get sick, I know I've already got this plan in place, doctor, somebody can come help take care of my other kids, or if I'm a single parent, how do I quarantine?
Yes, just like you would have a birth plan or a pregnancy plan, have a plan in place just in case you get sick. Be immediate. Face mask, cover, wash things down. That's the first thing that you want to do to make sure that you don't spread this to anyone else that's in your household. Call for help. Have that backup plan. Hey, this is and the help shouldn't be someone who has underlying health conditions. It should be someone who can withstand being sick. But have those measures in place. Have those conversations with your kids as well.
Perfect. Thank you, Dr. January. We know that sometimes this information can be really scary, and we're hesitant to even ask these questions because if we say them out loud, they might come true, but it does help give us peace of mind as we prepare. Absolutely. And give some control in a situation we don't have a lot of control over during COVID-19. So look for this episode and all of our other episodes and how to contact Dr. January through all of our media outlets on Facebook, YouTube, Instagram. STL TV is also on Twitter. Thank you all for joining us. Be well.